Well, thanks for joining me today, David. Clearly, the birth centres at Corbar and Darley are held in great affection by many local people, especially those who have been born there along with their children. So why do you feel that these centres are no longer needed?
I don't think it's that they're no longer needed, and I wouldn't say that there's no reason not to have had the affection for them. I would hate to have bought things on behalf of the NHS over the last few years that people didn't feel that they had some value for. And certainly if you look at the towns of Matlock that serves Darley Dale, look at Buxton as Corbar, they're held in great affection by their population for good reason, because they provide nice services that people enjoy. But we're going through an NHS at the moment where we've got to make some really tough decisions about what are the things that give the lowest clinical gain, the lowest clinical added value for the money that we're spending. And unfortunately, against lots and lots of lists, things like Corbar and Darley give great experience but don't really add clinical impact for the NHS. Now, there are things that are going on in Derbyshire at the moment that are great. There are things that I'd love to put in place in Derbyshire and Derby at the moment in terms of new services for eating disorders, psychological therapies in the area that Corbar and Darley covers. I'd like to put in place better stroke services, better dementia services, and all of this against a background of flat funding in the NHS. So it's not whether I really don't value Corbar and Darley, it's the fact that I'd like to take that money and do other things for the people of Derby and Derbyshire with it. I'm glad they're held in great affection. I really emphasise I would have been disappointed if people had said, yeah, shut them, we don't care, because that would have said I'd wasted a lot of money and a lot of people's time over the last few years providing substandard services.
And if the birth centres were to close, what services will be left and how will maternity services be provided?
Okay, if we think of maternity services and births as part of the whole before birth and what we call the antenatal period and the after birth, the postnatal period, those services will continue to be provided locally. We want to work with GPs, whether it's to do with testing, whether it's to do with help for mothers, whether it's to do with help for mothers after birth. Those services are traditionally provided locally. They're provided locally throughout lots of places in Derbyshire, places that don't have their own birth centre. They still have those local services, and we'll continue to work with GPs to make sure that the right services are provided locally. I can understand the distress that people will feel that if somehow the birth has to happen in Macclesfield or Stockport or Chesterfield, that the entire birth experience, everything before the birth, all the classes, everything after the baby's birth, the support for the mum, if they had to happen in those towns as well, to an extent it would be a harder message for me to sell. But the loss of the birth centre doesn't stop good mother-related services happening in those towns, and those are things that we'll be continue to work with the GPs on delivering in the areas currently covered by Corbar and Darley.
And how can mums at what is naturally a stressful time be expected to travel miles further to the major hospitals, and could babies actually be born in ambulances on the A6, David?
Well, there's two challenges to that. Whether I'm expecting the people who are currently served by Corbar and Darley to travel unreasonable distances. I have to say that outside of the areas served by Corbar and Darley, mums continue to travel much greater distances than that to get services elsewhere in Derbyshire. Derbyshire has a mixture of rural and urban areas, and people do travel for receiving their health services. I have to say this idea of being stranded on the A6 in the winter on the way to Stockport is the one that I find the hardest to go through, because if that was true for maternity services, it would be true for people with cancer, people with dementia, people who've had falls. And I think it would disregard the work that we do with Derbyshire County Council to make sure that emergency preparedness is really high in the winter. It's very noticeable that when you get some of the stories about that type of occurrence happen, and I'm not saying that it didn't really happen, but often that is a folk memory of things that might have been true in a winter in 1961. And you can see that on the websites, and I do have a lot of sympathy. I don't want people to be distressed about the later stages of birth. What I know is that lots of people from those areas have really well organised birth experiences in Macclesfield, in Stockport and in Chesterfield. I also know that even in December last year, one of the harshest winters we'd had in a long time, women who turned up at Corbar and Darley were women who had pre-arranged sessions. They weren't turning up in distress in early hours in unplanned ways. It simply did not fulfil that part of the NHS offering to those mothers.
What if women need a bit more time after the birth on a postnatal unit? Women are currently transferred from the main units at Chesterfield or Stepping Hill to Darley or Corbar for a few days respite after the birth if needed, and they can't speak highly enough about the care they've received.
It's an interesting dilemma, that, because the concept of respite care is that you're taking a respite from something that's untreatable, that you're having to have a release from this. I don't believe that birth is an illness. Birth is a period that has a real challenge for a family. It has a traumatic period in the anxiety immediately before birth. You give birth, you get the best NHS care, you get that kind of support that the NHS wants to give you, and then you should move to a home environment. I'm really glad that the respite care happens at the moment, but I would question its clinical value. If I go back to this issue of clinical gain, what did the NHS gain in real clinical output from that time that's being spent in respite at Corbar and Darley? Now, that at its heart is not saying that it was a bad thing or that people experienced a bad event. In fact, I'd be really, really traumatised if people said, the NHS spent a lot of money, I spent 5 days in convalescence and it wasn't any good. I'm glad that the money we spent gave a good experience. I have to say that in a time when the NHS is making some tough choices, is it the right way that we should be spending our money? And if we wrote this as a clinical experience, we have a very, very heavy clinical intervention, which is giving birth. We look after the mother, we look after the child, and then we have a period at which the family should move back home to a domestic environment. I don't see the additional clinical benefit of that respite period. And in fact, if you don't have that type of unit, people don't take that convalescent period in a birthing unit. They remain in the place where they gave birth until such time as they're ready to go home, and then they go home. To say that because it was a good experience means that it's something that the NHS should sustain really doesn't stack up. Orthopaedic hospitals used to have that same sort of period. You would have a convalescent period after orthopaedics. We now know that people go after operation, get their mobility up and return to a domestic environment. And I still think that not only does it mean that the Corbar period and the Darley period for convalescent and respite is unnecessary, it's out of keeping for how birth should be treated. Emphasise again, birth is not an illness. Birth is something that happens and then you return home.
And what would you say to people who say the centres just haven't been promoted enough?
Well, categorically that's not true for Darley. And I'll talk about Corbar in a minute, but if I concentrate on Darley first, Darley, when we last talked about questions over its viability, was backed by a national campaign that got Radio 4 coverage, was on Women's Hour, was backed by a front page article in The Guardian. It was publicised to people who were promoting Darley at that time, had a clear business plan for how many births need to be taken forward at that unit in order for it to be viable. They proposed a business plan. The unit simply hasn't, as people have expressed choice, risen to anything like the levels that were proposed by the people who told us to keep it open in 2006-07. So to say it's not been publicised, Darley, national publicity, still didn't rise to the choice. Corbar, it's a harder thing. What I would say is that I am told constantly that Corbar is a valued part of the Buxton community. It's at the heart of civic identity. My question would be, if it's at the heart of civic identity, it almost should promote itself. What I know is that probably about a third of the births that could happen there, and maybe it takes events like this to promote its identity and people to realise that, but when people make choices about where their birth should take place, they time and time again choose not to express Corbar as the place of birth. I do hear the stories that Stepping Hill, for example, discourages a relationship with Corbar. That's part of patient choice. The volumes at Corbar are simply not enough. Well, they're at the very margins of what we would consider safe clinical effectiveness. If I was told that the answer to Corbar was to massively promote it and that patients would be drawn from other areas, yeah, I've heard the argument before. What I know is that Corbar over 20 years has not lacked an identity in Buxton, and yet people are still not using it. As far back as 1992, the viability of Corbar was spoken about, and then the answer was, well, if it's promoted, people will use it. Over a long, long period, It's not rising to the critical levels of birth necessary to make it economic, make it a good use of NHS money. And yet it is a key part of the civic identity of Buxton. So it's not wanting for profile, it is wanting for people who choose to use it.
And just finally, David, how can local people be reassured that their thoughts, fears and concerns will be taken into account when the decision on whether or not to keep Corbar and Darley open for births is taken?
Okay, well there's two aspects to that. There's the one that makes me sure that I take account of those fears. It's what you call the Lansley 4 test, which is that I cannot make draconian changes to NHS services over the heads of local GPs and over the heads of the local population. So they have that guaranteed by the Secretary of State. More importantly, I don't think that you can actually go through this sort of change process without having a real extended period of public conversation. We will not be making any decision without first talking to big local stakeholders, and then in the period from August to October this year, having open meetings at which we present our findings. And this is not a decision that will be taken in a back room of some smoky building that just makes a decision on the future of maternity. We have to take this decision in the full broad daylight of public decision making. What I would say though is hear the fears, register the fears, take those as risks. They will be part of the decision. But a fear and a concern are not sufficient reason for us to back off from what is the proposal that we've done. I do want the public to talk because we are able to be shifted on this one, but it has to be more than a generalised fear and concern at a diminished NHS service. It has to be about real value that is going to be foregone if we stop this proposal taking place. At the heart, the NHS makes its best decisions when it makes honest ones in public. I've been honest about where I stand on these units. I'm willing to take that conversation to the public. I want to have that conversation with the public. I don't want that to be in a back room, but I must emphasise that fear and concern is not a sufficient reason for us not to carry on with this proposal.
David, thank you for taking the time to answering these questions. Thank you.
Thanks, Rob.